Q9105. Loss of cabin pressure may result in hypoxia because as cabin altitude increases, A. The percentage of nitrogen in the air is increased. B. The percentage of oxygen in the air is decreased. C. Oxygen partial pressure is decreased. The correct answer is C. Loss of cabin pressure may result in hypoxia because as cabin altitude increases, the oxygen partial pressure is decreased. In a pressurized aircraft cabin, the air is artificially maintained at a higher pressure to ensure a sufficient supply of oxygen for the occupants. However, if there is a loss of cabin pressure, such as during a rapid decompression, the cabin altitude increases and the pressure of the air decreases. As a result, the partial pressure of oxygen also decreases, making it more difficult for the body to take in an adequate amount of oxygen during breathing. This can lead to hypoxia, which is a condition characterized by a lack of oxygen supply to the body's tissues and organs. It's important for pilots and passengers to be aware of the signs and symptoms of hypoxia and take appropriate actions, such as using supplemental oxygen when flying at high altitudes or in the event of a cabin pressure loss. 9106. Hypoxia is the result of which of these conditions? A. Insufficient oxygen reaching the brain. B. Excessive carbon dioxide in the bloodstream. C. Limited oxygen reaching the heart muscles. The correct answer is A. Hypoxia is the result of insufficient oxygen reaching the brain. Hypoxia is a condition where there is a deficiency of oxygen supply to the body's tissues and organs, including the brain. It can occur due to various reasons such as high altitude, reduced oxygen levels in the atmosphere, impaired lung function, or inadequate oxygen delivery to the tissues. When the brain does not receive enough oxygen, it can lead to impaired cognitive function, confusion, dizziness, and other symptoms. It is important to recognize the signs of hypoxia and take appropriate measures, such as using supplemental oxygen, descending to a lower altitude, or seeking medical assistance if necessary. 9856. Human behavior? A. Rarely results in accidents unless deliberate actions are performed. B. Is responsible for 3 out of 4 accidents. C. Is well understood, so behavioral-induced accidents are exceedingly rare occurrences. The correct answer is B. Human behavior plays a significant role in aviation accidents and incidents. It encompasses a wide range of factors, including pilot error, decision-making, communication, situational awareness, and adherence to standard procedures. Despite advancements in technology and safety measures, human factors continue to be a leading cause of accidents in aviation. Understanding human behavior, addressing human factors issues, and implementing strategies for human error reduction are crucial for improving aviation safety. 9778. An experienced pilot trying to meet a schedule? A. Can expect the flight crew to alert them to problems or areas of concern. B. Will always err on the side of caution. C. Can fail to perceive operational pitfalls. The correct answer is C. While experience can be valuable in aviation, even experienced pilots can fall into the trap of trying to meet a schedule or achieve certain objectives, which can lead to a failure to perceive operational pitfalls. This can include overlooking potential risks, neglecting proper risk assessment, or disregarding warning signs or concerns raised by the flight crew. It is important for pilots, regardless of their experience, to remain vigilant, maintain situational awareness, and prioritize safety over schedule pressures. 9778-1. Automatic decision-making is? A. A reflexive type of decision-making. B. An impulsive type of decision-making. C. An internalized type of decision-making. The correct answer is A. Automatic decision-making is a reflexive style of judgment based on experience and training that is most frequently applied in emergency situations when there isn't enough time to practice making analytical decisions.